The Ebola virus was first associated with an outbreak of 318 cases of hemorrhagic diseases in Zaire. Of those 318 cases, 280 of them died, and they died quickly. The same year, in 1976, 284 people in Sudan also became infected with this disease, and 56 of them died. This virus infects both monkeys and people. The outbreaks of this disease is often self-contained. However, because it kills their host so quickly, it rapidly runs out of people to infect. The Zaire strain of Ebola virus has a mortality rate of 88%, which is higher than either the Sudan strain of Ebola or the Marburg virus, which is similar to Ebola. Ebola spreads through the blood, multiplying many organs. It causes severe damage to the liver, lymphatic system, kidneys, ovaries, and testes. The platelets and the linings of arteries are also severely damaged, which results in profusing bleeding. Mucous surface of the stomach, heart membrane, and vagina are also affected. Internal bleeding causes shock and acute respiratory distress, leading to death. Once a patient is infected with Ebola, the incubation period is 4 to 16 days. The disease is sudden, with fever, chills, headaches, anorexia, and muscle pain. As the disease progresses, nausea, vomiting, sore throat, stomach pains, and diarrhea are common. Most patients develop severe hemorrhages, usually between days 5 and 7. Bleeding occurs from multiple sites, including the digestive tract, lungs, and gums. Death occurs within 17 to 16 days. Ebola is spread from person-to-person contact within communities, families, and hospitals, or laboratory exposures. The understanding of the infection is largely unknown, although an association with monkeys and/or bats has been suggested. Ebola is a virus that can be isolated from the blood of people who are infected. It produces distinct antibody responses that are easy to detect. Its antibodies appear 10 to 14 days after initial infection. There are significant risks to healthcare workers and laboratory technicians in handling and processing blood or tissue samples infected in Ebola. There are no drugs to work against the disease. There are no vaccines. Therapy involving blood plasma from people who have recovered, anticoagulation agents, which attempt to reduce hemorrhaging and interferon, have been used but had limited success. Their effectiveness remains controversial. The most effective way to reduce or prevent transmission of this outbreak is through the proper use of protection of doctors and nurses. This includes using gloves and masks, and having doctors change their gloves after every single patient is treated. Their effectiveness remains controversial. The most effective way to reduce or prevent transmission in an outbreak is through the proper use of protection for doctors and nurses. This includes the use of gloves, masks, and gloves being changed after every patient. Another important protection in a hospital is being sure all equipment is properly sterilized. People don't carry the virus. They get sick and their infected body and body fluids infect each other. Therefore, we can stop another outbreak of Ebola by making sure doctors and nurses use new gloves after every patient and every instrument is properly sterilized. A lot of doctors are unaware of the consequences that come from not sterilizing their instruments. If we fund a teaching program for all doctors and nurses to attend, all doctors and nurses will be educated on sterilization. Another reason why doctors and nurses don't change gloves after every patient is because they don't have enough money to keep using different gloves for every patient. Therefore, if we provide $7 million to go to the education of doctors and nurses and for new gloves and proper equipment for doctors and nurses to use, there should not be another outbreak of Ebola.